Guys, right to go? Very good. Thanks for joining us. We have 19,015 confirmed aggregate cases of coronavirus in Victoria. That's 114 new cases since yesterday's report. I'm saddened to have to update you that there are now 524 Victorians who have lost their life due to this global pandemic. That's an increase of 11 since yesterday. Of course, our thoughts, prayers and best wishes are with the families of each of those 11 Victorians. We send our deepest sympathies and our profound condolences to them. Those 11 include one male in his 70s, 5 females and 1 male in their 80s, 3 females and 1 male in their 90s. 9 of those 11 deaths are linked to outbreaks in aged care. There are 472 Victorians in hospital. 25 of those are receiving intensive care and 11 of those 25 are on a ventilator. A total of 2,210,447 test results have been received, which is an increase of 14,231 test results since yesterday. Can I again just urge each and every Victorian with even the mildest of symptoms, as soon as you have system onset, as soon as you begin to feel even moderately unwell, scratchy throat, runny nose, cough, headache, all of those well-known and well-understood coronavirus symptoms, please visit one of the more than 190 test sites across the state. Getting tested quickly as soon as you begin to feel unwell, even very mild symptoms, and then isolating at home until you get your test result, which is now averaging just under 1 day, is a profound contribution that you can make. It's such an important thing to give us the most complete picture of how much virus is out there, how it's presenting, change of transmission, giving us the most accurate and complete picture so that we can make the best decisions about the next phase and indeed the one after that. So again, I would urge all Victorians, please come forward and get tested if you've got even the most minor of symptoms. It's such a big, important and powerful thing that you can do. Quite a simple thing, but it makes a massive difference. There are 4,226 cases with unknown origin. That is an increase of 3 since yesterday's report, so 3 cases closed out by our coronavirus detectives over the course of the last few days. There are 406 healthcare workers who are active cases, and we again send our best wishes to each of them. We thank them for their care and compassion and their commitment to providing only the best care to their patients. We send our best wishes to them and we thank them and their colleagues, those who are at work right now and every hour of every shift in every part of the state. They are heroes and are doing an amazing job, and we're deeply grateful to all of them. That's why the decisions that each of us make as families, as individual Victorians, every choice you make ultimately is one between whether more healthcare workers will be exposed to this virus and become ill or less. So if we want to thank them for the work that they do every hour, then let's all see this through and let's see this second wave off by driving those numbers down further and further. That only happens by us all making the right decisions, and that's why we're so grateful, so proud of the vast, vast majority of Victorians who are doing the right thing. There are 2,830 active cases across the state. That number continues to fall, which is good news. Just quickly, in terms of the regional metro split, 166 cases in regional local government areas under stage 3, so those numbers continue to fall, and that's very good news. In Greater Geelong, 55 active cases, 3 new. Greater Bendigo has 10 active cases and 0 new cases. And Ballarat has 6 active cases and 0 new. So those 3 communities, or greater communities, that we were concerned about a few weeks ago have not just stabilised, those numbers are being driven down, and we're deeply grateful, not just to regional Victorians in those communities, but in every part of regional Victoria. There are rules, they're being followed, great sacrifices being made, but that strategy is working. And to have that small number of active cases and a steady decline in active cases is very encouraging indeed. In terms of aged care, as at the 30th of August, we have 1,277 active cases. In terms of just a minor clarification, but one that is important, as per this morning's Victoria Aged Care Response Situation Report, the total number of deaths associated with aged care outbreaks is now 382. I'm advised that one previous death has been recategorised and unlinked from an aged care outbreak today. So while there are 9 new deaths linked to aged care outbreaks reported in today's update, the difference in cumulative total compared to yesterday is in fact an increase of 8. I hope that makes that clear. Now, just before I ask Dr. Anthea Rhodes from the Royal Children's Hospital to talk about one impact that the pandemic is having in relation to care and support of our littlest Victorians, and that principally relates to the numbers of parents bringing forward little bubs, bringing forward their children to be vaccinated, to get the important jabs that they need in order to be fit and healthy and to protect the entire community. I just wanted to make a couple of comments about where we find ourselves. These numbers are coming down. We will see some variation day to day. They'll bounce around a little bit. But in general terms, we're seeing a fall across each of the key metrics. The strategy is working, and that's a credit to every Victorian who's made a powerful contribution to that end. But we just have to stay the course on this. At 100, at 94, at 114, whatever the number around that number, we simply could not open up. Those numbers would explode. We would finish up in perhaps an even worse situation than we have been in recent months, and we can't fritter away all of that good work, all that sacrifice, that pain, the challenges that every Victorian has endured and worked through. We can't have that count for nothing. So what we have to do is stay the course on this. Once we see these numbers fall further, and once we have certainty, and that will be quite soon, we'll be able to talk in more definitive terms about what the weeks and months ahead look like. I understand that and appreciate fully that everybody wants that clear sense of what the next steps will be, but they need to be announcements that can be relied upon. They need to be announcements that are based in the best of health advice, in data, in science, in the evidence. And what we can be certain of right now, these case numbers are too high for us to open up, and they are still too high for us to put forward a definitive plan. Now, there will be a plan. It will come soon, but it will be one that we can be confident of, not something that potentially gets us a few weeks of people being happier, but then ultimately has to be revised because it didn't mean much when you first announced it. I know that's challenging. I know everybody wants this to be over. Nobody more than me. We all want this second wave to be defeated, but it needs to be defeated properly so that it's not some smouldering fire that then takes off again and potentially burns more intensely than it ever has. We simply can't have that happen. So there will be a time soon where we can talk in more definitive terms about what the weeks and months ahead look like. I'll make some announcements tomorrow in relation to how we're going to engage with industry, for instance, to make sure that we're getting the latest and best input around what that opening up should look like. That is not for today. It will be as soon as it possibly can be, and we will give people as much notice as we possibly can. We understand the need and the urgency and that sense of fatigue. It's perfectly reasonable, but all of us have to stay the course on this and defeat this second wave comprehensively. Otherwise, we won't be able to lock in to a COVID normal with any certainty that those arrangements can be stable and long-lasting, and they may need to last for many, many months. We want those to be the lightest touch set of rules possible, rules that balance both the protection of public health, but also, so protecting lives, but also protecting livelihoods and making sure that we can open back up again, rebuild businesses, repair the damage that this pandemic has done to us right across the state. That, I think, is best done where you've got the greatest certainty that those rules can stay in place, because you've driven case numbers down to such a low level that any outbreak, that any additional positive case, we can literally pounce on that and make sure that it is contained. That's what we're working towards. That's what the strategy. It is working, and it is making it much more likely that we can get to that place. But it's still just a little too early for us to be able to map out an absolutely definitive plan. That's the honest, frank, and upfront position that we find ourselves in. I'm not going to stand here and make announcements that, as I make them, I really have no confidence that I'll be able to deliver them. I don't think that would be fair. But it won't be much longer before we can have some more detail, we can have more to say in more detail, and with the certainty that I think every Victorian is absolutely entitled to. Now, I did mention Dr. Anthea Rhodes is here from the Royal Children's Hospital. Very grateful for her making herself available. Childhood vaccinations are critically important even during a pandemic. The Royal Children's Hospital, which has a very dear place in all of our hearts, it's a great comfort to every parent across the state to know that we have the greatest centre of paediatric health care anywhere in the nation, and indeed one of the very best in the world right here in Melbourne. They do an amazing job, but they're very innovative. So they've been using a whole lot of different methods, and I'll now invite Anthea to come forward and just talk to you about how important it is to continue and how safe it is to continue getting the health care that you need, whether it be vaccinations for your kids or other health care. All of our dedicated clinicians and health services have put in place COVID-safe plans, and people should come forward and get the care that they need, whether that be primary care at a GP level or more involved care via hospitals. If we don't have people coming forward and getting access to the care they need, then we'll simply have people's health basically deteriorate, and more people having to present to the emergency department. We don't want that to happen. So Dr. Rhodes can take us through immunisation.
Thank you, Premier. Good morning, and thank you for the opportunity to be here today to share some of the initiatives that are happening at the Royal Children's Hospital here in Melbourne to help keep families able to access healthcare for their children safely throughout the pandemic, and also to provide an update on some data from the latest Royal Children's Hospital National Child Health Poll that tells us a bit about how families are responding when it comes to accessing healthcare through the pandemic. So we did find that in our survey of over 2,000 Australian parents, about 3,500 children, that about a third of children who have been injured or unwell during the pandemic have had their healthcare delayed by a parent. And as the Premier mentioned, 1 in 5 children under age 5 years have had a routine vaccine delayed since the onset of the pandemic in March. The main reason that parents gave for delaying care was fear or concern about their child or themselves catching COVID-19 in a healthcare facility or service. It's very important that we acknowledge, of course, parents' concerns when it comes to the health and well-being of their children, and also recognise that they are working incredibly hard to keep their children and their families safe, but at the same time to reinforce the message that healthcare facilities are safe places for families to access care for their children, and that they should not delay accessing care in the event that their child needs to be seen. In terms of vaccinations in particular, a number of parents felt that perhaps vaccines weren't important at the moment in the setting of the pandemic, particularly here in Victoria where children are largely at home. Some families were of the misunderstanding that because their children aren't exposed to other kids, perhaps they're not at risk of catching some of those vaccine preventable diseases, and hence they're putting off having their children vaccinated. It's very important that families realise that, in fact, if we don't keep our kids up to date with their routine vaccines, when we do return to face-to-face learning, which we hope is not too far away, and children go back into childcare environments and the like, that those children who are not up to date with vaccines will be at risk of contracting vaccine preventable diseases, and that's things like whooping cough, measles, chickenpox. If our community as a whole is not up to date with vaccinations, then we risk the herd immunity coming down, and that means we can see outbreaks of these preventable diseases. So the last thing we want to see off the back of the coronavirus pandemic is outbreaks of these other preventable diseases. So in response to some of these concerns, as we've just heard mentioned, at the Royal Children's Hospital we've launched a drive-through immunisation service for families just this week. This allows parents to safely access routine vaccinations for their children. It also gets around some of the hurdles that parents told us about, where they're having trouble getting childcare for other kids so that they could perhaps attend a healthcare service. This is available to all children in Victoria from birth through to 18 years who are due or overdue a routine vaccination. But of course we encourage people always to access care closer to home wherever they can. Importantly, many other facilities, healthcare facilities and providers across the state are also looking at similar innovative measures. So there are some GPs who will provide drive-through based services, and other local council areas and some of our metropolitan hospital partners as well. So of course if you wish to visit the Royal Children's Hospital, we will welcome you and help you to get your child vaccinated, but encourage you wherever you are to contact your local healthcare provider and look at the safest options for you to keep your child's vaccines up to date. Outside of vaccination, other routine healthcare of course also remains very important. As I mentioned, we were concerned to learn that some parents have delayed presenting with an unwell child in the setting of the pandemic. Very important again to reassure families that healthcare facilities are safe places and that they must not delay attending with their children. It's also important that families are aware of many of the innovative measures and practices in place to deliver care in alternative ways. So telehealth is a hugely successful innovation that has really grown off the back of the pandemic. At the Royal Children's Hospital in the last month alone, we have delivered over 60% of our appointments via telehealth. And since the start of the pandemic, over 11,000 telehealth appointments have happened through the RCH. And we're not alone in this model of care. Across Victoria, many other places are also delivering this, our GP colleagues and also other hospital-based facilities. So for families who might be anxious about accessing care, where appropriate, starting with a phone call to see whether there might be an alternative to face-to-face care as a way that they can keep up their health care for their child. I think the important message is that we've all learnt that the pandemic is more of a marathon perhaps than a sprint, and so thinking of healthcare as something that you will attend to after the pandemic is not an appropriate or safe message, particularly when it comes to our children. Instead, we need to think about safe ways that we can continue to access and deliver care through the pandemic, and the immunisation service is just one of those things. Thank you.
We've got questions for Anthea first, mate.
I noticed that some of the presentations to the ED, I think, are down 60%. How much of that would account for the fact that kids aren't going to schools and playgrounds and breaking arms and things like that, and how much of it is parents too scared to bring their kids?
Yeah, absolutely. So we have seen a huge reduction in the number of children presenting to the emergency department. It's at about 60% of what we would normally see. And a proportion of that is, if you like, something of a silver lining of children being socially isolated. So just as keeping apart keeps us protected and children protected from catching coronavirus or COVID-19, it also protects them from contracting many of those other very common childhood infectious illnesses. So a lot of things that we would normally see, gastroenteritis, influenza, for example, are at very, very unusually low levels this year, and that certainly accounts for some of the downturn in presentation to healthcare facilities. But there is a proportion that will relate to those people who are perhaps not confident to present or attend, and obviously we don't want to see even one child not having the healthcare access that they need to get in a timely way.
Given those situations, are you seeing circumstances where children are perhaps coming in several days after when it would have been ideal, and therefore they're sicker or worse injured, have worse injuries than they would have previously?
In some isolated cases, there have been situations where children's care appears to have been delayed, and that has resulted in consequences for those children. But fortunately, those situations have actually been incredibly rare. So obviously, we only have the data that relates to children coming into the hospital, and there are many other places that children can be accessing care outside of doing that. So the fact that we haven't seen large numbers of more unwell children suggests to us that perhaps they are accessing their care elsewhere. Maybe that is in primary care, maybe it is through telehealth or nurse on call appropriately, in a way that means that they don't have to come to the hospital.
The hospital overall, what sort of difference is there in terms of occupancy, like capacity? Do you have a lot less children in beds actually inside the hospital as well?
So across the board, we have had areas where we've had reduced admissions, so that's children in the hospital that need to stay in beds because of those downturns that we've talked about. So influenza, for example, typically would be something we'd see quite a number of children very unwell with usually at this time of year. And fortunately, we've had almost no cases that have required admission to the hospital, which is very likely a combination of the fact that we saw very high uptake of flu vaccine this year. So we have had some positives when it comes to vaccination. And at the same time, we've had the social distancing that we've talked about, which means children have been protected from catching many of those common infections. So we have seen a downturn in admissions.
On telehealth appointments, how much has that increased on what you'd see before the pandemic? And what do you think will happen after the pandemic? Is that something that's likely to continue?
So with regard to telehealth, previously, prior to the pandemic, it was offered but in a very limited way and primarily to families who were living outside of the metropolitan area of the hospital but still required a specialist opinion, and we had a way to actually access telehealth for those families. The scale up has been enormous, so it would have gone from fewer than 5 to 10% of our appointments to now being 60 and at times up to as high as 75% of appointments. So it's been an enormous area of growth, and a large proportion of those are families within metropolitan Melbourne who are choosing to access care in that way. To answer the second part of your question going forward, so we are undertaking a very large study to look at the benefits and the impacts of telehealth. That includes for individual families, there's economic benefits for families in that they don't necessarily have to take as much time away from work, they don't have to physically come in and present to the hospital, and some of the logistics and the costs that are involved in that. So there are some definite benefits from the family's perspective, and then also for us as healthcare providers, being able to access and see families in their homes gives us another avenue for care as well. So ultimately it will depend on funding, and the outcome remains to be seen, but we would like to be hopeful that there's a place for this type of delivery of care into our future.
You mentioned 1 in 5 children out of the survey have had vaccinations delayed. Do you know if they were mostly babies and really little children?
So this was children aged between birth and 5 years, and it was a similar spread of those under 2 versus between 2 and 5 years of age. So the vaccination schedule, as you may be aware, is quite heavily weighted to the first year of life, when a number of vaccines happen quite frequently, and then it slows down as children get older. So in that first year, there are a number of vaccinations that children do need to receive quite close together. So that's a more at-risk period for children falling behind. One of the vaccines, the rotavirus vaccine, the very first dose has to be given by 14 weeks of age, or the child's not eligible for the rest of the program. So what might seem like a small delay when parents are feeling overwhelmed or feeling that something's not a priority can then have longer term consequences when it comes to catching up for that individual child, and obviously the implications for the broader community on our herd immunity too.
And there was a lot of reporting when there was a cluster linked to the NICU at RCH. No cases presently at the hospital now, is that the case?
There are not any current inpatients at the hospital with COVID-19. Fortunately, we've had very fewer than 15 children admitted throughout the period of the pandemic with COVID-19. So whilst parents are concerned, and we understand their concerns about this virus, our experience and that of our colleagues around the world has been that fortunately for children, in the vast majority of cases, coronavirus is a very mild illness, often even asymptomatic, and is very unlikely to make children very unwell.
To go back to the rotavirus vaccine, are there
Yes.
any other types of vaccines where if it's delayed it can have longer term consequences?
So for any vaccine on the schedule, keeping up to date with the schedule increases the coverage for that individual if and when they're exposed to that particular virus or infectious disease. So if a series of delays happen, then their individual protection will fall away. So for each vaccine, the importance of keeping on time is relevant.
Great. Thank you so much.
Thank you.
Thank you.
It's a very long pause there. I thought you might have had no questions for me.
Premier, is the government being unreasonable by not providing businesses with a few more details at this stage about what the easing of restrictions might look like?
Well, we've still got 2 weeks to go before stage 4 is scheduled to end. I don't think it's unreasonable to put forward a plan that's accurate and based in data and science and evidence and the best of medical advice. And this strategy is working. We're going to defeat this second wave. I understand that there's fatigue and frustration there. That's absolutely acknowledged, and it's real. And as soon as we can provide a clear pathway forward, and that'll be quite soon, we will do that. But we've got to have a plan that is not just there as a statement of what we hope to be able to deliver. It needs to be a clear plan that we are confident we can actually deliver. And I do appreciate that it is frustrating, but a plan that's real is always much better, I think, than one that is rushed out and really doesn't have the data sitting behind it, the evidence, the science sitting behind it that says, right, we've got this on a trajectory and we're going to get down to an acceptably low level of cases by date X, and then based on that, here's what the next phases look like. That's what we're working towards, and we'll have that out as soon as we possibly can. Can I just say again that at this stage, when we've eased at other points during this pandemic journey, we've usually given people about a week's notice. I don't think we've very often, if at all, given people 2 weeks' notice. That is the nature of this virus. It's got a 10-day to 2-week life cycle. So what's occurring today really may change quite rapidly over the next week, the next 10 days, the next 2 weeks. That's what we're working towards. And as soon as we can give people as much notice as possible and produce details that we can all have some degree of confidence in, that's exactly what we'll do.
Can you guarantee, though, that if the numbers keep going the way they're going, keep going down for the next week, that businesses, the community will be given details by next Sunday, a week before?
Well, I can guarantee that I'll provide the most detailed plan I possibly can as soon as I possibly can. So the most detailed plan, as soon as I can possibly provide it, will be provided to every single Victorian. And we've just got to be guided. I know it's frustrating. Everyone all the way along, myself included, would love to have been able to be handing down plans and details and roadmaps that were essentially chiselled in stone. That is not possible. This is wildly infectious, highly variable. It changes fast. It changes rapidly. But the strategy is working, and we can be confident and hopeful and positive that we are going to defeat this second wave. And as soon as I can provide that detailed picture of what future phases across weeks and months will look like, I will do that. And at that point, people will be able to have the confidence to know that it's not so much a wish or a hope, it's a detailed plan based in evidence and science and the best of medical advice.
Is there any way you could accept the business situation is very complicated? Is there any way you could perhaps announce earlier what the social implications of going back to stage 3 might be like?
There may well be different ways in which we can provide people across the board with the clarity that they want. As I said, it's not going to be a long way off, but I'm not in a position to make those announcements today. At 114 cases, if we opened up now, then we would be potentially in a very short period of time in even more difficult circumstances than we were a couple of months ago. Having said that, though, as soon as we can possibly have a clear, science-based and, as best you can, a plan of certainty, we will absolutely announce that. And it will include, Laurel, both the way we live our lives socially as well as economic activity. We are about saving lives but also protecting livelihoods as well. We know there's been a lot of damage done. We know that there is a sense of fatigue, and we know that people want to get past this, absolutely. And that's why there'll be a clear plan released with as much notice as we can possibly provide, and the accompanying certainty that comes from waiting to get more data, waiting to do more modelling, waiting to have more information and advice underpinning that plan. That, I think, is much more important than perhaps rushing something out today, where we really, as we announce it, we don't have the degree of confidence that it's real. That is not, I think, in anybody's interests.
Have you you were to deal with the crossbench about the state of emergency framework and what does that look like?
No, there's still very productive discussions going on with the crossbench, and I'm very grateful to them. They've engaged meaningfully with the government. That occurs not just on these matters, but on all matters. We've always had a good faith approach to these things. Sit down, talk through the issues, try and find common ground. That is our policy. That's the way we operate, whether it be in relation to these matters or any other matter now and certainly into the future. And I think that cooperative partnership and that constructive dialogue has served us well, and I'm confident that as Parliament sits next week we'll get both a set of arrangements that protect public health but also give us the legal certainty to have a plan to open up, a plan that runs for a considerable period of time. What we want to try and find here, just to be clear about it, is we want numbers down at the lowest possible level. We then will have a detailed plan that sees us ease off these rules and then find that COVID normal, and then it is our intention to have a degree of stability, lock into those rules, lock into that COVID normal and have it run for many months. That's what business wants, it's what business tells me they need, and that's exactly what we're working to deliver.
Is it fair to say you've taken your 12-month timeline off the table though when it comes to that state of emergency?
No, I think it's fair to say that negotiations are always best conducted face-to-face or on a Zoom, as the case may be, in these pandemic times, and not necessarily negotiated or conducted at a media conference. So out of respect for that process and in real gratitude for the constructive way in which we've engaged with the crossbench, I will let those discussions continue, and when we have an outcome we'll be only too happy to report it to you.
On the 2nd of August, yourself and Police Minister Lisa Neville announced a state of disaster for a month.
Yes.
That's set to expire in a few days' time.
Yep.
Are you likely to extend the state of disaster as well?
There's a process that sits behind that where advice from both the Minister and the Emergency Management Commissioner is provided to me. I haven't yet got that advice, but I think it is likely that we will extend those arrangements. They're the ones that sit behind curfew, for instance, and a range of the other stage 4 measures that are very, very important. It doesn't mean that for whatever period that was extended, the rules have to be unchanged. There can be variation within that, but these legal protections or legal frameworks put beyond doubt the measures we're taking to protect public health, the measures we're taking to limit movement. And as painful and as challenging as that limiting of movement is, and fundamentally changing the way we live our lives, it's working. These case numbers are coming down, and we will continue to see them fall whilst everyone plays their part, and that's why I'm so grateful to every Victorian who, with even the mildest of symptoms, is coming forward and getting tested. People who are observing the curfew, people who are not going to work, even if they work in a permitted industry, if they've got even the mildest of symptoms, people staying at home and isolating. All of these things, they come with a degree of pain, they come with a real cost. But the benefit is a strategy that is working. And once this strategy has been successful and we've ultimately defeated this second wave, we want to get to a situation where we can gradually ease out of these rules and then lock in a COVID normal, potentially for many, many months. There'll be the odd outbreak, there'll be the odd case. But if you get it down to really low levels, then you can have confidence that you can pounce on those, you can contain those, and we don't then have to go back into shutdowns, we don't then have to go back into rules that impact everybody. It can be a much more localised and isolated approach, if you like.
To pick up on that point, in late May and early June, we literally had on some days 0 cases, 1 cases, 2 cases. So
Correct.
An opportunity for the Department of Health and Human Services to pounce on any outbreak. So how can we have any confidence that when we do get to 1 case or 0 cases, that the Department of Health will be able to pounce, in months to come?
Well, I'm confident that it's a big team. It's a team that is well equipped, but volume is never your friend, Samaya. When you've got hundreds and hundreds
if
of
the volume is only 1 or 0,
yeah, well,
that is
there
not
weren't
much
many
of a-
days like that. And what finished up happening was that behind the scenes, you, in that period or maybe a little later, you had a number of high-risk workplaces. You had a number of, not exclusively, and I'm not making any judgments, this is not a criticism, it's just a statement of fact. You had some, at least a portion of total transmission was, I think, very much attributable to a combination of large families and lots of socialising, lots of activity, and high-risk workplaces. And that's the spread back and forth, and all of a sudden we're not talking about 20 cases, you're talking about a couple of hundred, and we all know what happens when you get a ref number that's at 1.5, 2, every infected person's infecting 2 other people, and then they are in turn infecting 2 other people, and so on and so on. So I think we face the prospect of a very different set of circumstances, but at the same time, we will need to be incredibly vigilant, and that's why the team is working very hard. They have made a whole range of improvements, very few that deliver hours, many of which deliver minutes. That's the frustrating nature of this. It is a real grind to find the small wins, the small savings in time that mean you can get to people quicker, and therefore you can contain both them and their close contacts.
But as we start opening up and we start easing out of stage 4 restrictions, we're still going to have high-risk workplaces. We're
Yes.
going to have people in the community mingling. So how do you prevent what happened after the first wave?
Well, I think we have very different circumstances in that I think we are across many of those high-risk workplaces better than we've ever been. Again, I'm not conceding the point that people weren't doing their very best months ago. They were, but I think we've got probably a more constructive, a more meaningful, a more safe partnership with many of those high-risk industries today than we've ever had. The contact tracing team is bigger than it's ever been, and it will remain larger than the task. I think that's really important in order to make sure that you do have confidence that you've got the reserve capacity. Plus, you're managing fatigue. Those coronavirus detectives have been at this for a long time. So the need to rotate staff, the need to make sure that you've got fresh legs, as it were, that's what we have to do all the way through this. It'll be a long, long fight to keep this contained, but I think our staff are equal to it.
On Parliament, Parliament was adjourned earlier this month when it was supposed to sit, and now it's sitting this week so it can get this legislation through. Does
Yes.
that mean it's safe now to sit for normal sittings? You can bring Parliament back and...
Yeah, I don't think it'll be normal, Laurel. I think the advice of the Chief Health Officer is and I'll leave it to the presiding officers and leaders of the respective houses to speak in more detail, but I think the notion of staggering things so that you've got one house sitting and then the other house sitting not necessarily at the same time, different provision around the minimum number of people in the chamber, I think it's going to look different for quite some time, but we'll have more to say about a sitting program. But I'll leave it to others to make those announcements. It won't just be about sitting this week. We'll be sitting more regularly. As safe, provided it's safe, then we'll be there doing that important part of our work.
The Federal Treasurer has said that even a 6-month extension to the state of emergency is too long, and that the decisions of your government are impacting the economic recovery for the country as a whole. How do you respond to that?
Well, I've not seen Treasurer Frydenberg's comments, but he's got a job to do, so do I. I haven't seen his comments, and I actually have no interest in having an argument with him. What I would say is this: there is no economic recovery until you get the health problem fixed. That's the story of our nation. It's the story of every nation across the world that is dealing with this wildly infectious and deadly global pandemic. It's a 1 in 100 year event, and whilst the notion of hundreds or thousands of cases a day and just going about your business might be attractive, there's just no basis in science for that. So we need to make sure that we've got the numbers at the lowest level possible. That's the first point. And secondly, state of emergency powers are not there to keep the place closed. It's there to allow us to open up. And I'd give you, and through you, the Federal Treasurer, a very simple example. It is from that act that we have the power to require someone who has this virus to isolate at home for 14 days. The notion that we would get to the other side of this, we would say to businesses, righto, here's a package of support, here's a set of rules, open up, let's help you open up. But by the way, everyone who's got it only has to stay home on a basis of honesty, and then the thing gets out again, away again, and we're into a third wave. I don't think that makes much economic sense. So I'm not interested in having an argument with anybody really, other than with this wildly infectious virus. So I haven't seen his comments, but our position's very clear. No rules make it really, really hard to open up and to put a plan in place that's got the certainty that business wants. And without any doubt, the opening up that I want, not just to protect lives, but to support livelihoods, to repair the damage that this pandemic has done to us.
Do his comments suggest that state and federal cooperation is over?
No, I wouldn't suggest that at all. I've got a very good working relationship with the Prime Minister, and that's the most important thing. There's a lot written about this, there's a lot said about this. It's pretty simple, really. The nation and our state absolutely requires political leaders, regardless of their political persuasion, to work together. That's why we do it, and that's why we will continue to do it. The Prime Minister and I have got a very, very strong and positive relationship, one that is all about outcomes, and the outcome that we want is to defeat this second wave and then to have rules in place that are as light touch as they possibly can be, but necessary rules to facilitate opening up, getting people back to work, getting businesses back profitable again, and repairing the damage that this pandemic has done to us.
Sorry, just back to Parliament, can I just ask when you can expect normal sittings to resume? Will it be within weeks, in September?
I can't give you a date, Laurel, but I'm more than happy to have the presiding officer speak to you.
And just
It's
on those,
pretty
sorry.
important though, yeah.
Yeah, I'm not saying it's unimportant, but it's the advice is not provided to me. It gets provided to the presiding officers, and they have a discussion, they make arrangements. I know there's a cross-party committee that's been doing lots of work on this, and the notion of blending some people in attendance and some virtual. Again, I think you'd appreciate that's not necessarily something that I run that's not something that I'm necessarily doing, but others are, and I'm more than happy to put you in contact with them.
It just seems like Parliament was put off until you needed it, and now it can be called back, and now it's on again.
Well, whether it be convenient or not, or how it looks, when the legal framework expires, you have to have a new legal framework, otherwise there wouldn't be one, and all the rules that are driving these numbers down would be open to being challenged, and we simply wouldn't want that. It's nothing more or less than that. If someone else in the team can give you a clearer picture of what September and October and November is going to look like from a parliamentary point of view, I'm more than happy to have them speak to you.
And do you have or does the presiding officers have the latest advice on whether MPs can vote and sit remotely?
So sorry, Samara, I just missed the first part of that.
Do the presiding officers have advice on whether Parliament can
I believe
sit
they do.
remotely?
I believe that the Chief Health Officer has provided advice to the presiding officers.
On sitting remotely?
Oh, no. I'm sorry, it might be at cross purposes.
Can parliamentarians sit and vote remotely?
Yeah,
Like
I don't think.
via Zoom
I don't think
or-
that'd be. That's not. Sorry, just to be clear, I now understand your question. Sorry, that's not a matter of health. That'll be a matter of law, and I'd leave it to the presiding officers to update you on that. There's been a cross-party group that's been working really hard on that particular issue, and I'm not quite sure where they've landed.
Do you know when they might land somewhere?
No, but I do know that the presiding officers might be able to give you a better picture than me.
Given the way the numbers are going, do we think that stage 4 could continue past September 13?
It's too early to say. It'll be based on health advice. It'll be based on case numbers and data. That's the honest and frank answer. And before then, though, we'll be able to give people a clear sense of the different stages that will be a feature of the weeks and months to come. We'll give people as much notice and as much certainty as we possibly can. That's not for right now, but it will be soon.
What did you think of the scenes on St Kilda Beach yesterday afternoon?
Look, I can understand that the weather was better than we've had for quite some time. Indeed, the weather today is better than we've had for quite some time. I can understand that, but I just again say to every single Victorian, let's not make any choices that put at risk all the progress we've made and could render all the sacrifice we've made meaningless. We don't want that. No day at the beach is worth that. I want to get past this so that people can spend as much time at the beach as they want, and they can do it safely. Now is not the time for that. These lockdowns are not imposed for fun. They're not imposed for any other reason than they are on the advice of the experts. Critically important to drive these numbers down, to defeat this second wave, and then with certainty to begin opening up again. And not just opening up for a few weeks. The aim here is to put the fire out so that it doesn't flare up again. That means we can have a long period of relative stability where the rules don't need to change, where we can have a sense of certainty around jobs, profits, people moving around, repair and recovery. That's what we're about. Opening up too early, because it might be popular, well, I dare say if in only a matter of weeks after that time we had to reimpose rules, I dare say people would think that was probably not the best decision to make. We've just got to stay the course, and I know it's tough. I know it's difficult. That's why I'm so proud of Victorians who are sticking together. They're staying apart and keeping each other safe, but they are sticking together as well, in that we all acknowledge that this is something that we'll all benefit in, and it's something that we all pay a really big price if we don't get the health problem fixed first. And we're well on track to do that.
There is a so-called Freedom March planned this afternoon. I think Luke Cornelius described them as the Tin Hat Brigade on
Yes, he was
Friday.
very plain spoken about these matters, and I don't think that's a bad thing. Many of us might like to speak in very plain terms like that. We sometimes choose not to, Laurel, but I would say this. Victoria Police are doing a great job. They're out there protecting people. Fining, imposing sanctions, doing the work they're doing is about protecting people. We've got 11 families who today will be planning funerals, and if we don't get this right, and if we don't all make a contribution to driving these numbers down, if we make choices that, you know, are much more about us rather than something that's got a collective sense to it, then we'll see these numbers go up and we'll see more people die. But even if that weren't enough of a motivation, we'll just see the rules on for longer. If you break the rules now, they'll just be there for longer. And that's not what I want. I want to get these numbers down as low as possible, defeat this second wave, ease out of these rules, and then find a COVID normal that runs for a long time. Hopefully not. Hopefully a vaccine comes soon. But we have to assume that it'll be some months, perhaps many months away. That's where true repair and recovery can be found, not the notion of bouncing in and out of rules every 3 or 4 weeks. That's why I can't provide a definitive plan today, but we will as soon as we can.
Have there been any recent cases at any public housing towers across the state?
Not that I'm aware of, but I'm happy to follow that up. I know that we are relocating, this I think goes directly to the point, we are relocating a number of people, whether they be positives, out of the towers so they can isolate away from family, or leaving perhaps a positive case in the tower and taking family members out. There's a big team doing that. It's a lot of hard work, but I think that's paying real dividends in terms of the amount of infections and change of transmission we've seen in those highly dense, highly populated environments. And also, might I say, we haven't had the sort of fatalities and the very tragic outcomes that were almost a certainty if we hadn't have taken difficult decisions, very hard decisions, but necessary ones.
Looking to move a number of residents out permanently as well. Can you talk us a little bit through that process?
Look, on any given day there are families, particularly larger families, who are on a transfer list, and if there's opportunities for us to be able to move them to more appropriate accommodation, then we do that as a pretty regular thing. But in the current climate, knowing that the infectivity of this thing is not going to change, it's going to be with us for a long time, then some of those domestic arrangements are probably not conducive to people's health and safety. Not all of them, but some of them. So we're always looking to try and put people into the most appropriate housing.
The program that you've announced about shifting people out for a couple
Yes.
of years into private residential properties, there's only about 420 properties available. That's still quite a small portion of the total number of people living in those towers.
Yeah, this is based on, based on need, but also based on the preferences that many residents will have expressed. Many people, when we could have a conversation, and we have had conversations with many people, and they're happy to stay where they are. That's their home. That's the community they're part of, and you don't want to upset that. But for some people, they have expressed an interest in moving. There may be a heightened interest in moving because of events of the last six months or so. But we try and process those in good faith. We try and make sure that we've got the most appropriate housing options for all of our tenants. And sometimes that'll be in a tower. Or other times it'll be a walk-up. Other times it'll be a standalone house nowhere near the centre of Melbourne. And of course there are public housing tenants in regional Victoria as well. So we try and accommodate each of those and their individual needs.
Will
How
that
are you
program?
deciding-
Will that program mean that you move them out for 2 years and then you move them back in 2 years later?
Oh, I think it gives the 2 year point, part of that gives people some certainty, but we'll have more to say about housing in the weeks and months to come.
Would
How do you
Would you
decide?
concede that the moving out of residents to private rental is a band-aid solution? We need a major boost to public social housing in Victoria?
And today's not the day for me to be making announcements about that, but I'll have more to say about public housing and housing more broadly soon.
How do you decide if there's a big demand for people who want to move out of the towers? How do you decide, and who do you give preference to who is allowed to move out?
Yeah, look, I'm happy to have Richard Winters, the Housing Minister, come back to you and give you a sense of the sort of criteria and how that process works. That's not something that I'm directly involved in. But look, if 400 were not enough, then we would look to do more. So the individual criteria, though, it's probably best if Richard comes back to you on that.
And how are we finding these properties? We know that there's always been huge demand for public housing that has been unable to be met.
Yes.
How can we meet it now?
Well, head leasing arrangements have been very successful when it comes to family violence. So we were able to secure a very substantial amount of stock that took the place of emergency housing while we built that emergency housing. This is a similar policy in that there is rental stock out there that is available, and I think at the current time there are many people who are prepared to lease to the government. That's a pretty secure lease to sign, and that's what's driven this. Plus, it's much quicker, of course, than if you were to try and construct additional units. But we'll have more to say in broad terms about housing, about this industry as well. Obviously, part of recovery, the construction sector is a very big part of our economic mix, and we want to make sure that they're as strong as they could possibly be.
In terms of new cases over the past 5 days, there seems to be an overrepresentation of people aged between 20 and 29. There's a significant portion in that age bracket. What do you put that down to?
A feature of this pandemic, certainly in the second wave, has been a third and up to a half of our new cases have come from that age group. That's my latest number. I'm happy to get that checked for you, just in case I'm not giving you anything other than accurate information. But 40% certainly would be, I think, a reasonable claim to make. Look, I think largely it's driven by the fact that they are the people that are of working age. They are the people who are out doing the shopping. They are the people who are moving around the community and are potentially exposed to more of this virus than others who simply aren't moving around, aren't doing the shopping, aren't going to work. I wouldn't make much more judgment than that, and I'm certainly not here today or any day to be criticising people. I would just say the virus doesn't discriminate whether you're 25, 55 or 85. The virus does not discriminate. It's wildly infectious, and there are people both here in Victoria and Australia, and certainly many people across the world, hundreds, thousands of people across the world who are otherwise healthy, were young, and have either lost their life to this virus or, increasingly, all the medical journals, all the evidence tells us many people are experiencing this much more like a chronic condition. This is not something you shake off in a week. There are lasting issues, lasting challenges for you to deal with and to overcome. So no one wants to get this, and all of us, no matter our age, our gender, our postcode, our income level, none of those things matter. The virus is unconcerned about those things. It will do you harm no matter what your circumstances, which means all of us need to play our part right across the board.
Has the Health Department followed up with all or a majority of recovered cases in Victoria just to see what the long-term or the mid-term effects have been on those people?
I'm not briefed on that, but I think there'll be not just here but across the world, there will be an enormous amount of work done, study after study after study, and they'll all be benchmarked and peer-reviewed, and we'll have in fact almost certainly, we will have the greatest reservoir of information and data that we've ever had for any global pandemic event that we've ever known. So that will mean, obviously, that changes can be made, learnings can be embedded. I'm happy to have someone from the public health team and the infectious diseases team come back to you, but there will literally be tens of thousands of clinician researchers and other data specialists and others who will be working through this for months and years to come. It's a very, very big project and one that is unique.
There's been a lot of criticism on the backlog of contact tracing and the time it's taken the virus detectives to get in touch with people who are potential close contacts over the recent months and weeks. Where are we at the moment with that, given the numbers are dropping, and like yesterday we saw it back to double figures?
Yeah, I'm happy to try and get you an update. The metrics are essentially case interview conducted within 24 hours of DHHS being notified of the positive result. We've got about a 2-hour time, a 2-hour period that elapses between when a person is told that they are positive and when we are told that that person is positive. There's no queue there. We then do that. We begin that very challenging work of making contact with those people, conducting a detailed interview. We are 90 to 95% of all of those interviews are being conducted within the 24-hour window. There's always some people who perhaps don't want to be part of an interview, for whom their information is not correct, who couldn't be found at home, might be isolating somewhere else. Everyone's circumstances are unique. That's where the ADF and authorised door knocking is so important. In terms of close contacts, 48 hours is the key metric. I don't have to hand the most recent number, but again, we are getting to almost all of those in that specified time. And when you think about the volumes that have been involved across this journey, it's a mighty effort. It's a big team. They're all working very hard. They're doing, I think, an outstanding job. But whenever you're dealing with many thousands of people, there will always be some that are more complex than others for one reason or another. The issue with contact tracing sometimes can be, not always, but sometimes can be, a person may have a sense that they are a close contact and are waiting to be contacted when in fact they were never a close contact. That can be part of it. But again, they're all working as hard as they can, and every single case that they close out, you learn things from that. I dare say that they are a bigger and better team than they've ever been, and that will be critically important when it comes time to open up.
We're close to being able to see that detailed genomic data that was mentioned a few weeks ago
in relation to
public release, but how the data's been travelling through the
I'm not sure. I can chase that up for you. That's not released by me. It's not held by me. I had hoped that it would already be out, but I'm more than happy to chase that up.
Walk us through the government's decision to reject a crossbench request to set up a parliamentary oversight committee separate to PAEC, and that goes beyond PAEC's terms of reference, and that would have been chaired by a non-Labor MP.
Again, there are many upper house committees that are chaired by non-Labor MPs. I'm not here to go through the detail of what's been discussed. Those discussions are not finished yet, but I am very grateful to the crossbench for the positive way in which they're engaging with us. And when we have an agreement, we'll be able to share that with you.
Can you maybe walk us through then why, I guess, the government's reasoning or your argument behind rejecting that request? And why
I'm
you
not
thought it
conceding
wasn't necessary?
what's been rejected, what's been included, what's been agreed to. Those discussions are ongoing, and when they're concluded, I'll be in a position to be able to take you through them. If not me, then another member of the team will take you through them.
It'll be concluded because Parliament's
As soon as possible. Parliament sits on Tuesday, so there's been a lot of work going on over the weekend, and again, that's why I'm so grateful to the crossbench, each and every member. It's all about finding common ground, not just on this issue, can I say, but this has been our approach, and they raise many issues with us, and they will do in the weeks and months ahead, the years ahead even, and we'll always have that good faith approach because that's what gets you the best outcomes.
Just some major events. Premier Martin Pakula was quoted this morning as saying he still expects things like the Australian Open to go ahead.
Yep.
What do you envisage, realistically, that those big events that are make Melbourne so famous would look like in the next 12 months?
Well, what I'd say is that unless you comprehensively defeat the second wave and then lock into that relatively stable set of rules and do everything we possibly can to avoid this seesawing in and out of rules, in and out of lockdowns every month or so, then those sorts of major events become incredibly difficult. So that's another reason why the sense of stability based on science and data and a plan that we can have confidence in, that's why it's so important. In terms of big events, I'm confident that we can have those events run. They may look different. I think big events across the world look very different at the moment. There's probably not a sport, or a major event anywhere in the world at the moment that hasn't got a series of COVID restrictions and rules and looks and feels different. The key point, though, is that anything like those events is only possible once we defeat this second wave, and that's why we all have to be focused on that now.
You would
But
envisage
sorry,
have some form of crowds though?
I think that's more than likely. The question, though, how big those crowds are, it's just too early for us to say, and putting a number on it now wouldn't really mean much. But you know, we once we get past this very difficult period, and again the strategy's working, and we can be positive and hopeful. More than that, even I think we can be certain we are going to defeat this second wave, and that'll give us options that we simply will never have if we have case numbers continue at an unsustainably high level for an unsustainably lengthy amount of time.
When you say crowds are more than likely, does that include the Melbourne Cup, or too soon?
Too soon.
Or is that event? Yeah, is that?
Yeah,
event
I think that is. Again, it's always been my practice rather than standing here and making things up. I think when I can't give you an answer, when I just haven't got that certainty, I try and be as frank and honest as I can be, and I can't tell you what the Melbourne Cup will look like or what the Australian Open tennis will look like. But what I can say, we're all working as hard as we possibly can to find that COVID normal and lock it in with a sense of stability and certainty for many, many months, and to not have to go back to this bouncing in and out of restrictions. We don't want that. Get this done, see it off in its second wave, and then we can have a period of stability, economic activity, profitability, people back at work, people finding that COVID normal and living that COVID normal, as opposed to the really difficult restrictions that we have in place now.
Should there be exemptions for back burning so we can prepare for fire season with current restrictions? Or?
Well, I don't think it's a question of CFA not being able to comply with the rules. My understanding, and again, it is best if you speak to them because it's not a decision that we made, it's a decision that they as a fire service have made in the interest of their volunteers, in the interest of safety. It's not that they couldn't comply with the rules so much. I think it was that they felt that there would be too much contact and there would be too great a risk of people becoming infected with this virus. If I'm in any way incorrect in that, and if they can add to that answer, I'm sure that somebody from the CFA will be happy to do that. We can get someone in the office to chase that up for you.
In previous years during bushfire seasons, we've had, Melbourne fireys go either interstate or overseas to help battle their fires and
Yes.
have people come to Melbourne. In the middle of a pandemic, what could that possibly look like?
Well, that's the other point. We could have fires well before Christmas. That's what we had last year. That's why you've got to pull this up now. You've got to end this second wave properly, not leaving it there smouldering. You've got to put it out, and that's what we're all focused on doing. And then that will give us much greater certainty on the other side of that. And part of the other side will be a long, hot, dry, dangerous fire season. That's what we have every year. For all sorts of reasons, no fire season is ever easy, but it will be easier and less complicated if we have truly defeated this second wave now. So that's something that I'm giving a lot of thought to as well. The notion of trying to run a fire season where we had going fires with some of these rules in place because we hadn't defeated the second wave. That's very, very, very challenging.
But I'm assuming we'd still need to have travellers who enter Australia to quarantine for 14 days until we
Yes.
get a vaccine.
Yes.
How viable is it that we can get particularly international help to battle our fires here in Victoria?
Oh, look, so there's a few different ifs in that question, but if we need international support, or if other countries needed our support, then I'm confident we could put in place quarantine arrangements that would make that possible. And look, borders may be closed across the country, but I don't think they'd ever be closed to. I don't think they'd ever be closed to emergency services, particularly those who are coming to the aid and support of other states. And we've done that many, many times, and that's why. When you look at the number of people that are coming to Victoria to support us from other states, we're grateful to all of them, grateful to the governments that have sent them and the agencies that have sent them. That's no different to the way in which we all share resources and work together as one team every summer. Let's hope let's hope that we don't have a fire season as challenging as the last one, but you've always got to assume that you will. And that's just one reason among many about why we have to defeat this properly, comprehensively now, so that we're not having these sorts of restrictions or that complete inconsistency where the rules are on and off, restrictions and lockdowns on and off, month after month, for the rest of this year and well into next year. That is not the preferred outcome, and I'm working as hard as I possibly can to ensure that that doesn't happen.
We've had like contact tracing experts or people from the public health team from New South Wales and Queensland particularly come to Victoria to help out with our contact tracing team. Have they gone back?
Most of that work, Simone, most of that, not all of it, but most of it, apart from I think a very small number of very senior public health physicians, will have been doing their work over the phone from their own capital. So I don't think there's as much of that going on now. And of course, New South Wales, for one, as one example, have had a few of their own issues to deal with. So of course, we would never hold it against them to take back their resources. Our team is bigger than it's ever been, and obviously the numbers are lower, so the task is a little bit less. But having more people than you need is going to be a feature of the public health team and the contact tracing team for many months to come.
Just on the regional figures being low in New South Wales, where are you at in talks with Gladys Berejiklian in terms of maybe opening up the borders a bit more freely, especially for those in regional Victoria?
Look, that's a discussion that's ongoing. I've got no update on that today, but every day that we see numbers further fall in regional Victoria, I think we're a day closer to having those borders open, or at least having more movement than we do now. But of course, other First Ministers will look not just at cases or the lack thereof along their borders, they'll look at what's happening in Melbourne as well, and that's why it's so important that we get these numbers down as low as we possibly can.
Do you have an update, just on the suburbs boiling water?
What I'll do, I know that there was, I think, just as I was standing up today, I think that there were some announcements made around the suburbs that have to continue that boil water notice. I think that's best if those announcements and updates come from the water authorities, but I know the number of suburbs is coming down, which is very good. But for anybody who has is the subject of a boil water notice, you need to bring your water to a rolling boil. You need, for the purposes of making ice, beverages, cooking, cleaning, vegetables, all those, everything. You've just got to be really, really careful not to be consuming water that you haven't brought to that rolling boil because it can make you sick, and we don't want that. That won't be in place any longer than it needs to be, and indeed the number of councils, the number of local government areas that are subject to that notice, that order, are in fact coming down. There are high winds predicted for this afternoon and this evening, and that will present a challenge. So again, for what they've done and in anticipation of what they'll be called to do, on behalf of all Victorians, I just want to thank the SES and our emergency services. They've done an amazing job over the last few days, as they always do.
Is there an investigation underway into how this could possibly have been allowed to happen with the water? The idea that in 2020 you've got vast tracts of Melbourne unable to drink the tap water is extraordinary.
Oh, we have boil water notices, probably not on as big a scale. We have boil water notices from time to time. That can more often be a feature in regional Victoria, where there's obviously less people affected because you've got a particular treatment plant that services a smaller community. It might be more in geographical size, but it's less in people. Look, I don't have a point of comparison to give you, but I think it was a very significant event, very significant storm event. And, you know, no matter how strong systems are, there'll always be challenges. Even a backup power system wouldn't necessarily work in the circumstances that we faced. And the other thing too, though, Laurel, this is not to say that every drop of water is a risk, but you've got to take that precautionary principle. There is water in the system, principally from the overnight period when the filtration system was down, and you've just got to be very, very careful. We don't want people getting sick, and it's inconvenient, but it's a small thing to boil your water before you use it, rather than us avoiding that and people becoming unwell. We don't want that to happen, and it won't be on for any longer than it needs to be, and I think it'll come off quite soon.
Will they be able to seek sort of fee relief or compensation, do you think?
I'm not sure. I'm happy to chase that up. Again, the water is there. It's not like they don't have supply. They do, and the key point now is to for businesses and for households to make sure that when they're using their water, they bring it to a rolling boil. That's for them. That's for their safety. And I know that is an inconvenient thing, but it's certainly preferable than getting sick. And you've just got to follow the advice. That is the public health advice. Beyond that, I think the focus is trying to get as much of the damage the storm has done repaired as quickly as possible, and that includes having that public health advisory around boiling water only for so long as it's needed. The number of suburbs is coming down, and hopefully quite soon we can get to the point where no suburbs are the subject of that boil water notice. Any other issues? Please, I'm very grateful that Dr. Rhodes has joined us today, and we'll see you tomorrow.
Thank you.
Neither short nor sweet. Thank you, guys.